Hi, everyone. Welcome to another episode of Orthopod. My name is Mo Bendari. I'm editor-in-chief of OrthoEvidence, and I have the distinct honor of introducing to you Professor and Chairman of the Department of Orthopedics at the University of Arizona College of Medicine in Phoenix, Professor Mike McKee. Let me also state that Dr. McKee is also the current acting president of the Orthopaedic Trauma Association. Welcome, Mike.
Well, thanks very much, Mo. Thanks for having me on. I appreciate it.
Let me just get down to, if I could, to I think what most of our viewers are particularly interested in, and I have been watching with some degree of interest. COVID-19 remains to be a front page news item, regardless of our attempts to move on, right? Whether we're reopening or we're trying to move on to the business of the day. With about, I think, 14.6 million cases worldwide as of today, or in that ballpark. Just under 4 million cases in the US, and I believe Phoenix has jumped up another 10,000 or so cases in the last few days. I think you're at about 143,000 cases. Worldwide, though, there's 220 cases a day still. What does all this mean for you locally? I mean, there's been a lot of interest in what's happening in the United States, and I'm curious how this has impacted you directly and what your thoughts on this issue are right now.
Well, locally, Arizona is definitely a hotspot, both in terms of everyday life and the medical activity we see. So in terms of the hospital, my hospital is the sort of downtown core University Medical Center where a lot of these patients tend to end up. And we have around 190 COVID positive patients in the hospital right now, and about 50 are ventilated. And both these numbers have increased significantly, as you know. So capacity at our hospital is definitely an ongoing concern. We have been limited to the number of cases we can do. So we basically don't do cases in older patients or in patients who have potential risk factors for a bad outcome with COVID. And we don't do any cases that have a requirement for an ICU stay because those beds are in short supply. And we have a very rare case where the patient has to stay over. So essentially we're doing healthy people who can go home the same day in terms of our orthopedic cases. We also are still open for trauma, so we have a fair bit of that going on as well. And we didn't really have the real slowdown that other people have had, although there is a traditional slowdown in July and August in the Phoenix area when a lot of people leave because it's just so unbearably hot. So as opposed to Canada, where things definitely pick up in the summer, I can remember at St. Mike's, I think half our traumas came between the May 2-4 weekend and the Labor Day weekend. Here in Phoenix in Arizona, the summer is definitely a slow time for our business. So that's gone down seasonally. So overall, it's a major concern. We have daily updates from the command center in the hospital about what our bed status is, how close we are to being full, what the run rate is of PPE, et cetera. So it's a major ongoing concern for us. And if things don't improve, I could see us being closed down again for any elective surgery in the near future.
Mike, would you have called this is this a second peak that's happening? I mean, for us, Phoenix just Phoenix broadly, but Arizona came into the world sphere, as one of the centers in the US that has been having an increase in cases. Is this more like there was a period of time where there were restrictions and things were under control, and has it been a reopening that's caused a peak, or is this, I don't think it's a second wave yet. Or are you still part of this?
I don't think it's a second peak. I think it's just a continuation of the initial onslaught of this disease, really. So initially, for whatever reason, we were relatively spared, and people thought it's because we're geographically quite spread out. And our density is definitely much lower than cities like New York that were hard hit right at the beginning, or Miami. Phoenix is very much a spread out kind of place, or it was the weather or just being lucky. But initially we seemed to be doing pretty well. And we did close down and shut down things like everyone else did pretty severely initially, bars, restaurants, barbershops, gyms, et cetera, all closed. We did go from being fully closed to wide open. So essentially went from 0 to 100 instantaneously. It wasn't really phased. And a lot of people are suggesting that's the reason why now we have this sudden surge of COVID activity, because there is disease out there in the community. And if you don't social distance and you don't mask and you all gather in gyms and restaurants, then this is going to happen. And so I don't know what the reason is, but it's postulated that the immediate reopening of everything has led to the situation we're in now, where we're definitely a hot spot in the country.
Are you currently then fully reopened, or has there been a step back that said, okay, maybe we have to start reinstituting some of those distancing measures or masks for all? Canada's now, Ontario, for example, for the most part, is you're wearing a mask in any indoor facility.
So we have stepped back a bit. So restaurants and gyms are closed, and I'm not sure of all the specifics because basically I don't go anywhere anymore except go to work. I come home, I come in the side door of the house, I take off all my clothes and my shoes, I shower, and I come inside the house. And apart from that, we literally don't go anywhere anymore, except once in a while to shop for food. So, but there are a number of closures back. I noticed the gym is closed and things of that nature. So we definitely step back a bit to try and control things. The governor has said there's not a mandate to wear masks, although he does wear a mask and he is in favor of it. But most cities and individual places now have mask mandates. So like Scottsdale has a mask mandate. And if you go to the grocery store, you have to wear a mask, that kind of thing. So practically speaking, in my local environment, I'm masked whenever I go anywhere, basically.
Got it. And there's been this movement right now saying that, well, we're not going to likely see resolution. Not to say movement, but there's been theories right now. We're not going to see resolution in 2020. Is that your general take? Like, are things going to remain this way? And what will it take to, I guess, fully reopen again, let's say in Arizona, but broadly, let's say in the US? You have to eradicate it and be down to like single digit numbers. So what do you think it's going to take?
Well, Mo, at the beginning, I actually looked pretty smart in this whole situation because having lived through SARS in Toronto,
right,
and hearing that a similar coronavirus is coming in January and February, I was telling people both at the OTA level and at the hospital level that we have bad stuff coming down the pipe, and it's going to really hamper our operations. It's going to cause maybe even a shutting down of the hospital, and it's going to hurt society. And by the time that did happen in March, people thought that I was so smart. They were asking me for predictions about the stock market kind of thing. But I also thought, like SARS, it would go away. And so I thought it would run its course. There was a little second peak in SARS, but then that disappeared. And more or less we got back to some semblance of normal by the summer or fall of that year. So I personally did not see this continuing the way it has. And I'm very surprised that it's resurged so badly. I guess that other people did predict this would happen. At the present time, I don't see this going away anytime soon. I think there'll continue to be flare-ups as people let their guard down or states let their guard down, et cetera, and that the prevalence of the disease in the community is such that it's not going to go away. It's just going to smolder and flare up every now and then. And so we at the OTA were very much in the mind that we're going to have to live with this virus for a while and do things with the virus, and that it might be possible to have a meeting where everyone is screened coming in, everyone socially distances, everyone has to wear a mask, there's hand washing everywhere, we minimize close contacts such as labs. They were all canceled anyways, that kind of thing. But the local situation in Tennessee and Nashville in particular was just too bad to even have any idea of having a meeting there. So I think it's going to grumble along for a long time. I don't see anything dramatic happening until there's an effective vaccine that's widely distributed. And I doubt that's going to happen much before next summer. I do think that if you have a local area which has got things under control and where the prevalence is low, and you have people who are smart enough to wear a mask, socially distance, screen, not go to the meeting if you're sick, it will be possible to have an in-person meeting and to live with this coronavirus and not be crushed by it. But that just wasn't, unfortunately, the setting in Nashville right now.
Yeah, so I mean, I think what you're alluding to is the fact that you, I guess, as president of the Orthopaedic Trauma Association and the executive made a very difficult decision this year for the October meeting. So the October meeting right now is canceled in person, but it will be a virtual meeting then?
That is correct. So it's disappointing for us, and we were hoping in May and June that as things seem to be getting under control, that if things were quiescent in Nashville and there were very few cases, that we'd say to people, look, we're going to have an in-person meeting. We're going to do all the things that we've learned, and we have learned a lot about how to stay safe with COVID-19. We're going to do all those things, and if you feel you're in a high-risk group, or you feel uncomfortable coming, or if you have a travel ban from your academic institution, that's fine. Don't come. We'll have a parallel virtual meeting going on that you can attend. We were very much hoping that we'd be able to do that, but as things panned out, if you don't have local control in your area, it's simply not safe to have any kind of meeting, and that's the difficult decision that we were faced with.
Can you speak a little bit now to other groups? So, in terms of other meetings that are being planned, it would seem to me almost an inevitability that 2020 is going to have a hard time seeing any in-person meeting, just given the reality of what's happening around the world. But what about 2021? There are lots of groups, and I know you are well aware of the Canadian Orthopaedic Association's meeting that comes out in June, but there are many other meetings. The American Academy has a meeting coming up in March, I think, usually in March. What's the likelihood that they're actually going to remain as large group interactions? And I guess the psychology here is will the local authorities or the local policies allow even gatherings that big? I mean, it just seems to me that the idea of stadiums or anything where there's a large gathering is going to be very, very difficult unless there's complete eradication, because of the risk right now of no one's immune and we don't have a vaccine. So there's a risk always.
I agree completely, and I know the Academy has significant concerns about next year's meeting. I will say this, that barring an effective vaccine being available, meetings in 2021, probably for the entire year, will be very different from all the meetings we've had before. That's clear. Yeah. So I would suspect if a meeting occurs, it's going to occur only because there's good local control of the disease. For example, if you're going to have a meeting in Las Vegas, it has to be where the disease is under control. Their cases are going down, not up, and there's good local control. And then you have to do all the social distancing and all the masking and all the screening and all the separation, all the hand washing, etc. And you also have to understand there's never going to be zero risk. There will always be risk. There's risk with traveling anyways, as we all know. But in terms of COVID-19, there won't be zero risk. And you'll probably have to sign a waiver before you go to a meeting, say, hey, I'm taking this risk on my own knowledge, and if something bad happens, so be it. I'm not going to hold anyone responsible, as long as you do the things you're supposed to do to keep me safe. So I would suspect that some meetings will probably occur. They won't be as big as they have been in the past. They may not be as long as they have been in the past. Things like labs, where everyone gathers closer around a table, they probably won't happen. So the meetings will be dramatically altered. They'll be sporadic, and they'll be much smaller than before. And we'll learn something from those meetings. So some brave group will have a meeting, and the rest of us will watch and see what happens. And if it goes well and they're good and lucky and nothing bad happens, that will say, okay, this is how we're going to live with COVID-19 for the foreseeable future, and make something happen. I'm okay with virtual meetings, but pretty much everyone I've talked to, it pales in comparison to actually the camaraderie and knowledge you get from being with somebody in person. And so most of us are eager to get back to that when it's possible to do so safely.
The one paper that sticks in my head, I was thinking March, and there's a mathematical modeling paper in May in Lancet, where they said it takes about 4 people to enter in a new environment to create a new outbreak with COVID, because a lot of it's, it's the pre-symptomatic or asymptomatic transmission. So even if you're locally contained, what's the risk? I guess my psychology is, what's the risk of someone saying we're contained, yet we're going to open this up to allow people and migration to come in for that short period of time? And the risk almost invariably is, if you've controlled it in your environment, like New Zealand, they had 0 cases. Yeah. 2 people, one from India, one from UK, came in, and they had cases after that. And I wonder if that knowledge is going to also keep people from saying, if it's going to be a local meeting, we want people locally. We don't want to have people coming in from other provinces or other countries. At a minimum, other countries, I think is going to be hard. I'm just curious if, like with the OTA, if that was a consideration as well. I imagine it was. I'm just probably saying the obvious to you, but
no, it was absolutely a consideration. And so the thing is that if you have someone come from somewhere else, it's safe to do so, as long as that person is handled properly, so to speak. So that person comes in, goes to their hotel room, goes to the meeting the next morning, and they're screened at the door, so they're asymptomatic. And we know that asymptomatic people can transmit the disease, but probably not at the same ease with which someone who's heavily infected, spewing virus and symptomatic is. So first step is they're screened when they come in. No one shakes hands. The seats are all separated. Everyone wears a mask. You wash your hands in and out of every room. Then probably you can have people in that setting. And there's a situation I think in Missouri. And I don't know if there's this urban legend, but I've read it in a couple of places where two hairdressers had COVID-19, and they were masked and gloved and very careful with how they did things. They cut 140 people's hair, and none of those people got COVID. So it would seem that you can be in close contact with people and not transmit the condition. And so that's what I would hope would happen if anyone has the courage to have a meeting in that scenario. But as I say, it would be risky. There's no such thing as a zero risk. And you have to balance whether what you get out of a meeting like that, the importance of personal communication and camaraderie and friendship and much more effective meeting, in my opinion, is worth the small risk you take. And if you're a 70-year-old diabetic with COPD and on steroids, then you don't want to go. But if you're a 30-year-old person, even if you get COVID, the numbers would suggest your risk of mortality is extremely low, and it might be a risk you're willing to take depending on your situation. So that's where I see this going forward.
Yeah, and that does make a sense, right? Because if you're going to be attending these meetings, you're going to have to start changing the way you think about how you attend meetings. And the quote prior, what we would call inconveniences, I think are just going to just be part of routine evaluation. Let me ask you one point, and I'll have a final closing comment from you if I could.
Sure.
What do you think about industry? Industry's had to realign itself in thinking about, the in-person, which was so critical. But, the next 12 months, let's say, how are industry responding to, large organizations like the Orthopaedic Trauma Association? There's been a fear that, everyone's just going to walk away and they're not going to be supportive of this new approach to events. Are you seeing that big difference, broadly speaking, I guess?
Well, number one, I would say is I think one of the overriding concerns of big industry, and this is reasonable, is that they're very risk averse. Company A doesn't want to have a lab somewhere where 20 surgeons who go there get infected with COVID-19. That would be simply disastrous for them. So they're very risk averse. They don't want to send their people into a COVID-19 environment. They don't want to have them mingling with other surgeons. They don't want to have one of their employees identified as ground zero person that infects a bunch of people. So they're very, very cautious about doing that. And we saw some of that with the OTA planning. Secondly is that a lot of them have budgets that simply aren't being used right now. They've got money and it's not being used for the typical things that they would use it for, which is to have small meetings, have visiting professors, et cetera, et cetera. So they have the budget to do things with. Thirdly is that the ones that are more agile are latching onto the platforms that are online much more quickly and doing various instructional courses and things online that are much needed right now because we haven't got anything else. And so that's a major issue that companies that are more facile with that or more nimble can get going on very quickly. And there have been some groups that have done that extremely well. And there's a demand for information. So not unlike the things that you do, people want to hear what you're saying and theoretically what we're saying to know what to do going forward, what to expect going forward. So there's a lot of interest in that. And I think that's going to be the mainstay for the foreseeable future in this setting, as opposed to other things such as product development or introducing new products. I think this is a huge hit to companies that want to do that, because a lot of that stuff depends on in-person observation and instruction, and that's just very difficult to go forward with right now.
Yeah, that's very difficult. And I think we're seeing the same thing everywhere worldwide. And there's been concern about how do organizations, I won't say the word survive, but how do they thrive in the new environment that is virtual for the time being? And how does industry as a strategic partner remain engaged in that? Because, many small organizations are highly dependent upon industry involvement to support and also to make these things successful, meetings.
It's interesting to me in that before all this happened, you hear a lot about people saying, well, we can do Zoom meetings and virtual meetings. We don't need to go to Nashville and meet other people at the OTA. Yeah. We should do it all by online virtual platforms, et cetera, et cetera. It's only when you have the in-person meetings taken away from you that you realize really how important they are. And without trying to put too fine a point on it, it's just much better to be in person with someone. And I think that for a variety of reasons, that would be the norm that we'd all want to return to at some point in the future. In the meantime, since we don't have that safely, then the virtual platforms are going to become critical, and the organizations that perfect that and use that will thrive in the absence of anything else, the vacuum of any actual in-person meetings, and others will struggle.
Can you, like in the history of the Orthopedic Trauma Association, right, there have been probably only, you can count a handful of Canadian orthopedic surgeons who have ultimately led that organization. And, it's a great deal of pride for anyone in Canada, but certainly to see that, you have done just that. It is a premier trauma organization. Can you speak a little bit to what canceling the meeting, just it's chance that it happened under your presidency, what this actually means to you, and how this is actually impacting you on a personal note?
Yeah, so I'm another Canadian president of the OTA. Jim Kellum was the president, who's Canadian, transplanted now to Houston. Ross Layton was the president before. I think Joe Shasker was at one point, et cetera. So certainly there's precedent for that. I wasn't the first, but
No, right.
It's been a lot of fun doing it. Maybe not so much fun the last couple of months as you sort of watch things deteriorate around you in terms of the environment and what COVID is doing to everyone. One of the first major discussions we had was about the American Academy and Specialty Day and what we were going to do there. And at that point, I was pretty confident early that it wasn't going to happen because I'd seen it before and I knew it was coming. And so that decision was relatively easy. The annual meeting, though, is a crown jewel for us, and it's tremendously popular, and it's been growing every year, and the quality is going up, and we have pre-courses that are becoming sold out right away, et cetera. So, and financially, it's important for the group as well. So presiding over that decision-making process was very difficult. And we tried to balance the wishes of some people, myself included, who were very keen on having that meeting against the thoughts of others that thought it would be unsafe to have it at any cost. And so that was definitely a balancing act going forward. And I know there were some people who thought that we were being, kind of reckless by even thinking about having the meeting, which may be a valid point. But balancing those two issues going forward was difficult. I will say that, I had the support of the board, and the nice things about the board is that we don't always agree, but we're always very constructive in how we speak about it. And also the staff at the OTA, led by Kathleen Caswell, was fantastic. And there's a significant financial commitment to having a meeting. We had a lot of money on the table in deposits and guarantees and such that we had to kind of extricate if we weren't going to have the meeting. And that was a major issue. If you cancel your meeting without a clear reason to do so, then you're on the hook for those monies. And we didn't want that to happen either. So overall, in the end, it worked out quite well. We have gotten all of the deposits, et cetera, back and worked out of those commitments. But we will have decided to go back to Nashville at some point in the future. And I think it's 2026 to have an annual meeting there. So we've committed to that, which is part of the bargaining process. So overall, it's been difficult, but I like to think that we came through it as best we possibly could in the circumstances. And we've been planning a virtual meeting now since March, really, anticipating this might occur. So I think we're going to be well suited to go ahead with the meeting, and the program committee led by Steve Kottmeyer has done a great job there. So overall, I think that we're going to come through it pretty much unscathed. And we are very much hoping to have a great big meeting in Dallas and Fort Worth in 2021 in October. So that's what our focus is on now.
And you think that the new meeting, regardless of what's happened in 2021, will not be what we used to think of as a standard meeting? There are going to have to be some restrictions placed on attendees, the same way you've just described, pretty in a detailed way.
Absolutely, and it might be that we have labs with one person at a table instead of 6. Which obviously has issues as well. And the one clear thing is that, and I'm going to digress a little bit, back in SARS, I think the one thing that SARS really changed for us in Toronto was before SARS, you came to work no matter how sick you were or what happened to you. I can remember when I was a resident, having the flu or something terrible and calling in sick, and I told my staff person on the phone, I said, I'm not going to come in today because I'm really sick, sir. And there was this long silence. And he said, well, what ICU are you in? And I said, well, I'm not in an ICU. There was another long silence. And then I said, well, actually, I'm feeling better. Maybe I'll come in. So that was very much the prevailing atmosphere back then, was no matter what happened, you came in. And SARS changed that. You know, a lot of the transmission in SARS was medical personnel to other medical personnel. And so we realized that if you had some kind of infectious condition, we did not want you at work. And that was a very critical part of getting out of that pit, so to speak. And I think going forward in meetings, if there's any hint of you being sick, where you are probably much more likely to transmit a virus, then you do not want to go to that meeting. We don't want you there. We like you, but we don't want you there if you're in that kind of situation. So at the very least, some screening processes will be going on at those meetings. And I anticipate everyone will still be wearing a mask by then, and it will be all spread out just to prevent any, you know, flare up of the disease. So it will definitely look different from what it looks like right now. There'll probably be a parallel live streaming. So if you can't or won't go, then you can watch it on live at the same time.
When you look, Mike, and I was thinking of ending, but you just reminded me of one more point I'd like to ask you. When you look back at your career, is there anything that even parallels what this last year has been like, just in terms of, I dare to use the term unprecedented, but it's being used a lot, and maybe it's apropos to use that term?
It's been a tumultuous year, that's for sure. So there's no question this year has been tumultuous, a very difficult year. So the culmination of my own personal movement through the presidential line of the OTA to be president, and then have this happen. Some of the social upheaval, and there's been a fair bit of that in Phoenix as well, is tough. The inability to see friends and family in Canada, you know, it's major. 3 of my kids work in the medical field, so the last thing they want to do is hang around with dad and get coronavirus from a hotspot and then take it to their hospital. So, you know, we haven't been together in a while. So all of those things have made it extremely difficult year for sure. And I can't think of anything in the past. You know, SARS was bad, but it was brief. It was, you know, 3 months and then we've all moved on. I can't remember anything where all these things culminated so in such a short period of time in such a devastating fashion. And frankly, if a plague of locusts descended on Phoenix next, I wouldn't be surprised. It's that kind of year.
Well, I was speaking to some surgeons in the Congo, no joke. They've had flooding, locusts. They just got over Ebola and COVID-19 hit. And that is exactly how he framed it. And I felt like, we don't have problems.
Yeah.
We don't have problems.
Now I sound silly complaining compared to what those poor guys have to go through.
No,
So
and
there
there
are people who have it worse than you. So
you know,
having said all that,
yes,
the one nice thing is that for me anyways, I think I've gone to one meeting so far this year, and that was in January. And usually I'm away, I usually go on one short meeting, like a day or two, and one long meeting 3 or 4 days per month. So for me, I've spent a lot more time at home. I have 2 young kids at home now. I FaceTime with my grandchildren, et cetera. So for me, it's been nice that way, and that I've got a whole lot more time with the family, and that's been a good thing. And we're all still healthy and working. And, you know, we didn't have the shutdown that they did in Ontario. I know that, you know, some of my colleagues in Ontario were complaining about doing 1 case in 8 or 12 weeks, you know, and that's tough. So overall, I really don't have too much to complain about, I guess.
Well, I can't thank you enough for taking 30 minutes. And 30 minutes, I know for someone of your day-to-day lifestyle is hard to get. So I'm extremely grateful. And like I said, we're going to be rooting all the way through to the OTA. And I'm hoping that 2021 does see some face-to-face interaction. And I do hope we'll see you on the podium giving the oration I think you rightly deserve in 2021. But thanks so much, Mike, and can't thank you enough for taking time with us today.